Hi, I'm Dr. Kathy Keller. I'm the lead interpreting physician for women's imaging at Lake Medical Imaging and the managing physician. I'm here to tell you what happens when you have an inconclusive mammogram. Sometimes that happens because you have dense breast tissue and that hides things. And it shows up white on a black and white mammogram. The problem is that cancer shows up white too, and white on white is just difficult to see. So in that instance, you might be offered Cenobrite contrast-enhanced mammogram as a way to find out really what's going on. And it's quick and easy, you have the results right away. What's good about the Cenobrite is this. It can subtract away all that dense tissue. See, none of it's there, nothing is abnormal at all, which is beautiful. So she's a normal case, and now her mammogram for this year is conclusive, and we know that there's nothing the matter at all. Perfect. This is a lady's mammogram where she has dense breast tissue, and there are all sorts of places that you might wonder, are these breast cancers or not? But after the Cenobrite, it's easy to see that there is the cancer. That was very hard to see before, but now it's easy to see. There's no doubt about it. Everybody can make that diagnosis. It's just like a regular mammogram, but involves an injection in your vein of contrast or X-ray dye. It takes about the same amount of time as a regular mammogram with the same people you're accustomed to and familiar with in your regular mammography suite. So what will happen is that you'll have an IV started in your vein, and that will be the access for the contrast. Then we'll inject the contrast through that IV, and we wait about 2 minutes. Then the technologist will bring you over to the mammogram machine that you have your usual mammograms on, and you have a typical mammogram where we take 2 pictures of each breast, compressed top to bottom and side to side, and then the same thing on the other side. Then you're all done, just like a regular mammogram. They'll check to make sure that the pictures came out fine, then they'll remove the IV and put a compression bandage there. Now, while they're doing that, I'm looking at the images. As soon as I know that everything's A-okay, I'm gonna come tell you. You were normal today, I'm so happy. Yay! The contrast-enhanced mammogram that you had today and was normal, the Cenobrite examination is for a woman with dense breast tissue because the dense tissue can hide breast cancers, and that's the real advantage of that as far as I'm concerned. Great result.
Thank you.
And then you'll be all set and able to get dressed and go home.